Jenny McConnell, a physical therapist from Australia, is pretty world famous around therapists and athletic training as the founder of the McConnell tape job, a tape job for the patellofemoral pain, in which leukotape and Omnifix is applied over a kneecap to change the tracking. What I didn't know, and through these presentations, I found out that her tape jobs are actually a lot more varied and cover a lot more area. In fact, I was surprised that the McConnell tape job that I knew, the patellofemoral tape job, wasn't even represented in the presentation she had. So in this presentation, I'd like to present more on her other tape jobs. There is very little research that's actually done on the efficiency of her other tape jobs. So the follow-up research is usually on the patellofemoral. So just to do justice, I put in a lot of slides on how to perform the various tape jobs and various training, as well as her method of biomechanical analysis, which is, I think, very thorough. So the theory behind the McConnell tape job is it's a biomechanic analysis of the lower extremity, and then based on this analysis, there is a diagnosis and treatment for lower extremity injuries. By identifying the problems in the mechanics, a treatment protocol was addressed to address these issues. Typically, in the stance phase of gait, there is ability to train some muscles to support the foot and lower leg, as well as the gluteus medius. She really focuses on exercises for the gluteus medius. The tape is actually just to provide either support or pain-free exercise. A lot of the stuff is that Jenny McConnell presents is based on pain-free exercise or reducing the pain so the patient is able to go through their exercises to strengthen those muscles. I found it interesting when she did say that how long will you have to do these exercises, or how long should you keep the tape on? And she likened it to, well, how long will it take you to learn tennis? You know, some people it's fairly quick, and other people it takes years and years to master. So it's varied on the patient. The summary of current research, and as I said before, most of the research is done on the patellar taping. I actually could not find any articles that weren't written by Jenny McConnell. All the articles that evaluated her other tape jobs were based on Jenny McConnell's own research. So most authors, and this is from a summation by Crosley, Cohen, Bennell, and McConnell in Manual Therapy, that summarize her tape job. Is it clinically successful, supported by scientific evidence? Most of the research found that although it can change lateral tracking somewhat, it typically reduces pain. And Jenny McConnell herself says this kind of her goal is to reduce enough pain for the patient to be able to exercise. But as I said before, even the McConnell tape job that we know, the patella taping, wasn't even represented in this group of videos. So it's hard to find current research on the other taping. The prominent individuals, of course, are trained by Jenny McConnell herself. She has developed a McConnell Institute for teaching and demonstrating, and the faculty members of this McConnell Institute are considered the premier practitioners of the McConnell tape job. I've attached a link, so if you're interested in who those individuals are, they are on there. There are some that are in the United States as well, and they will train therapists and athletic trainers in this method. The limitations of the theory really are that the tape that's being applied even though it's advertised to have a high tensile strength, it does wear out quite quickly. I found in my personal practice, the heavier or the more intense the workout, the less the tape actually was effective. There is a method of taping that uses a similar tape, the low dye method, that uses the same leukotape, and they found that after only 10 minutes of walking, not running or jumping, after 10 minutes of walking, the tape did wear out. So with that being said, it is hard to say that that tape is actually changing the biomechanics or supportive enough that it changes the biomechanics. But I can tell you in my own practice, people seem to like it. How does it fit into other theories? Like I said, before I find the theory similar to the kinesio tape as far as increasing proprioceptive ability, or claiming that it increases proprioceptive ability and reduces pain. I also found a similar method of taping feet, the low dye method, as far as taping for supination or taping for pronation in the feet. They use the same tape and the same methods, and I did find some research on the low dye taping, and as I said before, after 10 minutes, it seems the tape wears out enough where after 10 minutes of training, it's no longer effective. Type of conditions and problems that best treated with this approach, it seems to be chronic injuries, but I have successfully treated subacute hamstrings and a subacute Achilles tendon injury in my own practice pretty successfully with the tape. At least supported the rehabilitation and treatment of that particular patient. Sorry. The tape method, as described before, she has taping for the feet, the shins, the knee, the hip, and the greater trochanter, I believe that's it, as represented in the following document. You'll see videos that represent those. These are a couple references I found on the patella taping. As you notice, Jenny McConnell's name is mentioned in quite a few of those. It seems that the majority of the research being done on her other tape jobs is done by Jenny McConnell herself. It would be interesting to see the same research that they put into the patellar taping put into some of her other methods. Particularly, I found the hamstring and the greater trochanter to be pretty successful. So I'd like to see how that worked out in the long run. Fairly low maintenance method.